Thank you for joining us for this special session. My name is Matthew Vino. I'm Executive Director of the Group Insurance Commission. This is the second of 3 annual enrollment information sessions for active employee coverage that we are holding this week and next week. For your information, we also hosted sessions last week for retirees. All of these sessions are being conducted virtually by Zoom, and we will post the slides we used today and the videos of the session on our website at mass.gov/GIC. We are holding these sessions this year, these special sessions, because we have a wider range of changes this year than we do in a typical year for reasons that I will address this morning. You can also find, in addition to the materials for this meeting, you can find the GIC benefit guides on our website, also at mass.gov/GIC. So please log on to view those. This presentation is intended as a high-level overview, but there's a great deal more information in those guides than we can cover in this presentation. For the hearing impaired, we do have CART services and ASL interpreters for this session. You can find information about those in the link in the Zoom chat. We also have, as I mentioned, ASL interpreters. Our plan this morning is to do a roughly 35-minute presentation followed by a question and answer session. So let's get started. So here's our agenda for this morning. I will start with a few brief comments about why we're here today. Then we will jump right into details about changes to the health insurance options for active employees and your dependents to help you start preparing for annual enrollment. Then we will speak to changes in your prescription drug coverage and flexible spending accounts. There are no changes to dental or vision benefits or our employee assistance program, so none of that is changing, but we'll touch on those very briefly. We will close with some tips and advice on how you can prepare for annual enrollment this year. And then, as I said, we will be addressing questions that are raised throughout the session. On the next slide, speaking of questions, you may submit those at any time during the presentation using the Q&A tab on Zoom. This is typically located at the bottom of your screen. We will review questions real time and respond to as many of them in writing, also right in the Q&A tab of Zoom. With such a large number of attendees today, looks like around 1,000. We may not be able to get to every question, but as I said, after we finish the presentation, we will verbally address questions that we think will be of a general interest to the audience. I also want to note that if you wish to make a more lengthy statement, we encourage you to send that in writing to us at gic.info@mass.gov rather than typing that into the Q&A. And finally, if you have questions about your specific coverage, including personal details, I encourage you to contact us directly using the phone and contact form found on this slide. We do ask that you not share personal information in the Q&A function. We do want to protect your privacy. On to the next slide. So why are we hosting this session today? As I mentioned earlier, this is an unusual year, and I want to explain why that is the case. So first, we want to start with our mission on the next slide, which I hope you're familiar with. To meet, and so of course, we have members front and center in everything that we do in providing you high quality and affordable benefits. And in order to do that, we provide the list of benefits that you see noted on the right-hand side of the screen. More specifically, we're here today because our annual enrollment period is now less than 2 weeks away. It will launch on Wednesday, April 5th and end on May the 3rd. As many people know, I suspect, this is the time when anyone eligible for GIC coverage can make changes to their insurance choices, and this is for coverage starting this coming July 1st. So we want to make it as easy as possible for you to interact with us at the GIC. So we have been hard at work over the last several years creating an online member portal called MyGICLink. This is now available to you all as long as you have a valid email address. You're not required to use the portal, as we will continue to accept paper forms and assist you by phone. But in the portal, you will be able to do just about everything online, self-service. You can review your current benefits, update your information, add beneficiaries to your coverage, and during annual enrollment, you'll be able to compare different options for health insurance that are available to you and actually complete your enrollment with a few clicks of the screen. So I encourage you all to visit the GIC's website to learn more about how to register for MyGICLink. So I said there are a number of changes to benefits this year, and I want to speak to why that is the case over the next few slides. So first of all, the GIC is required to recontract at least every 5 years with the companies that we work with to provide you benefits. Second, the healthcare system is constantly changing and evolving. And so our strategies need also to keep up with that change so that we can accomplish our mission. One big change that you're likely aware of is the merger of two of our longstanding health insurance plans, Harvard Pilgrim and Tufts Health Plan. You may also know that another of our plans, Always Health Partners, has changed its name to Mass General Brigham Health Plan. At the same time, hospitals and doctors' offices are also merging into ever larger systems, which the data shows makes healthcare more and more expensive. And new drugs continue to be invented, some of them miraculous cures, but they also come often at an enormous cost, which also makes our premiums more expensive to use. So to deal with these changes, we have to periodically adjust our strategies and our insurance plans. And then finally, as you see here on the right, when we contract with plans, when we go through this recontracting process, it really is a good and logical time for us to make some adjustments to the features of each of the individual plans. So with all of this, you can see that, you know, it's a year of more change than is normal this year. All right, so let's jump into what's changing and what's not changing for those of you who are eligible for active employee health insurance. At a high level, on the next slide, starting on July 1st, these are the companies that GIC will be working with to provide you coverage. And this is organized by plan category. And there are changes implicit here that I will address in more detail in the coming slides. First, in the national category, we have a new plan offered by Harvard Pilgrim. This is the plan only for those who reside outside of New England. For those of you in New England, we continue to offer a range of broad network plans offered by Harvard Pilgrim, Unicare, and Mass General Brigham Health Plan. As I mentioned earlier, this is the new name for Always Health Partners. Again, that is a change, as with the merger of Tufts and Harvard Pilgrim, that were done by those companies as private companies, not changes driven by the GIC. In the regional plan category in the lower left, Health New England will continue as a plan available to those who live in Western Mass. And Harvard Pilgrim and Unicare will continue to offer limited network plans. So that's high level what the plans will look like this year. As you can tell from the prior slide, many important elements of our health insurance are not changing. We will continue to offer a wide variety of choices and work with many of the same insurance companies, though there are some changes to specific plans that I will speak to. We continue to offer different types of plans, so HMOs, which feature a closed network of hospitals and doctors, and which have you designate a primary care physician. We also offer point of service plans, also known as POS, which are similar to HMOs, but with broader access to hospitals and doctors outside of the network. We continue to offer our indemnity plans, which give even broader access to providers. We will also continue to offer broad network plans, which offer access to providers all across the state, but also limited network plans for those willing to give up a little bit on the access side in exchange for a lower premium. Second, while we are making some changes to co-payments, and I'll talk about those more in a moment, we are not implementing broad cost shifting to members through higher co-pays, deductibles, or increases in your out-of-pocket maximums. And finally, as I mentioned earlier, we are making no changes to dental, vision, or life insurance plans. And also briefly, we are making no changes at all to the Health New England plan, which I said is available to residents of Western Massachusetts and those who live just across the border in Connecticut. So while there's a lot staying the same, there are a number of changes to active employee plans that you will need to consider as you make decisions during annual enrollment. I'll say more detail about each of these in the coming slides. But high level, with the merger of Tufts and Harvard Pilgrim, Tufts will no longer offer active employee health insurance plans for the coming year, so that's a big change. Second, some of your options will be different in the coming year based on where you live. Third, as I noted earlier, you will see a few targeted changes to co-payments in some of our plans. And finally, the names of some specific health insurance plans will be different in the coming year. So let's talk about these each in turn, and I will start with the Tufts changes. So as I mentioned, Harvard Pilgrim and Tufts, on the next slide, recently merged into one company called Point32 Health. So as a result of that merger, Tufts will no longer be offering Tufts Navigator. If you are in Tufts Navigator today, know that you will continue to be covered under that plan through the end of June. But during annual enrollment, you will have to select a new plan, or the GIC will essentially make that decision for you and put you in a similar Harvard Pilgrim plan called Harvard Pilgrim Explorer. The good news is that you have lots of options depending on where you live. Harvard Pilgrim, Mass General Brigham Health Plan, and Unicare will continue to offer broad network health plans. Also, for those looking to save a little bit on premium, you can consider one of the narrow network plans offered by Harvard Pilgrim and Unicare. So for us, it is really important that no one goes without coverage. So as I noted, if you're enrolled in Tufts Navigator today and you do not actively select a plan during annual enrollment, we will default enroll you into the Harvard Pilgrim Explorer plan. This is the most similar plan that we offer, but please be aware that the premium for this plan will be significantly higher than Navigator. That is why it's especially important this year to actively shop among your options that you see here on the screen. Next, we move on to Tufts Spirit. This is the narrow network plan, limited network plan offered by Tufts. As with Navigator, Tufts will no longer offer this active employee plan for the coming year due to the merger. Again, if you're in Tufts Spirit today, you will continue to be covered under that plan through the end of June. But when it comes to annual enrollment time, you will have to select a new plan, or we will default enroll you into the most similar plan that you are eligible for. So in this case, that would be either the Harvard Pilgrim Quality HMO, which is the successor plan to Primary Choice, or Unicare Community Choice. Again, it depends on where you live in the state where you will, the plan to which you will be default enrolled. As I said, just please be aware that if you do not act and we default enroll you into a plan, your premium could be higher than it is today. So again, it's really important this year to make sure you check out your options. In addition to the two limited network options, members also have the option to choose among the variety of broad network plans offered by Unicare, Harvard Pilgrim, and Mass General Brigham Health Plan. So moving on to Harvard Pilgrim, both their broad and limited network plans will continue to be offered as they are today, though they will have new names. The Independence Broad Network Plan will now be called Harvard Pilgrim Explorer, already mentioned that, and Primary Choice, the limited network plan, will be called Harvard Pilgrim Quality HMO. So other than the changes in name here, there is not a lot of change to these plans. Moving on to Unicare, the Unicare Basic Indemnity Plan that we have offered for many years is essentially being replaced by two separate plans, depending on where you live. So if you live in New England, a new plan called Harvard Pilgrim Access America will be your plan. I'll say more about that in a moment. And for those who live in any of the 6 New England states, Unicare Total Choice will continue as a plan option for you, among others, and will be very similar to the Unicare Basic plan that you have used in the past. So let's say more about the national plan. For members who have lived outside of New England, you know that your one coverage option has been Unicare Basic, which has been our most expensive plan. As a result of our recontracting process, we are pleased to provide a less expensive plan offered by Harvard Pilgrim, again called Access America. This plan will offer the same broad access to hospitals and doctors that Unicare Basic does. There will be no changes to co-payments, deductibles, or your out-of-pocket maximum from Unicare Basic. It is a nearly identical plan, but with a lower premium. Also, for those of you who are enrolled in Unicare Basic today, you know that for many years it has included an optional component called CIC, which stands for Comprehensive Insurance Coverage. You also know that you pay, as the member, 100% of that added CIC cost. The state has not covered a percentage of that cost as it does with your regular premium. However, as of July 1st, we are folding this member pay-all cost into the plan's regular premium. So what this means is that the state will now pick up its share of the cost. Your coverage will be the same as it was in Unicare Basic with the CIC, but the cost and coverage of the CIC will all be incorporated into the plan. This is all somewhat complicated, but the short story here, I think, is that you will get the same great coverage, but you don't have to pay that extra CIC cost all by yourself. As I mentioned, for those of you who reside in New England, on the next slide, Unicare Basic will now become Unicare Total Choice. It will continue to have the same broad choice of doctors and hospitals, and we're actually making a few additional changes to make the plan easier and simpler to use. Again, as I noted, with the new national plan, we are removing the member pay all portion of the GIC program, folding it into the premium and the coverage for this plan. Also, for this plan specifically, we're doing away with tiered copayments, replacing them with a single flat copayment, no matter which doctor or hospital you go to. I'll say more about that in a few moments. So the next change is to Always Health Partners. First, as I mentioned, they will change their name to Mass General Brigham Health Plan. I want to make sure that you understand that just because this health plan has the name Mass General Brigham in it, it is not the only plan that gives you access to Mass General Hospital or Brigham and Women's Hospital. You can still enroll in other broad network plans and have access to these hospitals and their affiliated doctors. Second, in this plan, in the past, it has not been available to those who reside in some parts of Western Massachusetts, but we are now able to offer it to any resident of Massachusetts, no matter where you live. Finally, since this is now a statewide plan, it will have the same copayments and deductibles as the other plans in that category. This means that some copayments will be higher and your deductible will be higher. So if you are in this plan today, it's important to evaluate whether it still meets your needs based on these changes, or if you would prefer to choose something that perhaps has lower cost sharing. Finally, Unicare Total Choice, which again will replace Unicare Basic for those in New England, and Unicare Community Choice will continue largely unchanged, but we have made some adjustments to copayments for a set of services in all of our Unicare plans. First, for all Unicare plans, we've added copayments for eye and gastrointestinal procedures when you get them at a freestanding facility, as well as outpatient services. And second, and this is specifically for Unicare Plus and Community Choice, we have made a minor adjustment to copayments for non-preventative visits to primary care providers. On the next slide, you will see that we've brought together all of the changes to member cost sharing that I've already described. Again, all of these details will be included in your benefit guides that are posted on our website. And again, this slide deck will be posted on our websites for you to study. Before we get to premium rates for these plans, I want to share this table, which will, again, also be in the benefit guide. This will be an important one to review. This shows each of the plans that we offer today in FY23 and those that are eligible for each of those plans on the left. It also shows on the far right the plan that you will be enrolled into if you do not act to choose your own plan. Again, so when you review your benefit guide, please pay close attention to this table. So now to round up the health plan changes, we will say a few words about how our premiums are changing. So there's a lot on this slide. and I apologize that we had to use small font to fill it all on one slide. But don't worry, if you want to spend more time with this, again, these slides will be available on our website. These are the full cost premiums for our plans and how they're changing from this year. I want to be clear that the premiums shown here are not the amount that you will pay. We will show that on the next slide. This is the total cost of the plan, which combines what the state pays and what you pay. What I'd like to draw your attention to is the fact that while a few premiums are increasing more than 9%, most are increasing by much less, and some plan premiums are actually decreasing. So we see a wider range of changes to premiums this year. And that's, again, one more reason to make sure that you do your homework during annual enrollment, review your decision guide, and make the choice that's best for you. And finally, on the health plans, this shows what you will actually pay based on your date of hire for each plan that's offered for the coming year. As I mentioned, this table will be included in your benefit guide. The rates shown here are monthly contributions that you pay. So these are the amounts deducted from your paycheck for each plan. So if you want to know how much you'll be paying in each pay period, you'll have to do a little bit of extra math. For example, many employees who work for the executive branch receive their paychecks bi-weekly, but that is not universal among GIC members. But if you're executive branch, you can divide this number by 2, and that will tell you how much comes out of your paycheck. I do want to note that if you are a municipal employee, the contributions are different, so you will need to reach out to your city or town benefits person to find out what those rates are. So that completes the presentation around our health plans. This is a reminder that you may submit questions at any time during the presentation using the Q&A tab of Zoom. We will review your questions real time and respond to as many of them as we can in writing, and we'll pull out some questions to address verbally at the end. And again, if you have questions about your specific coverage or personal details, please contact us directly so that we can protect your privacy. So now I'd like to turn to a change in how we provide prescription benefits for those enrolled in our active employee plans. CVS Caremark will replace Express Scripts as the company to provide your prescription drug benefits starting on July 1st. You will need to use your new CVS Caremark ID card, which will be coming in the mail whenever you fill a prescription. It's important to note that there's nothing yet that you need to do during annual enrollment as it relates to pharmacy benefits. Your coverage will automatically be switched over from Express Scripts, and CVS Caremark will be sending you a welcome packet and a new insurance card. However, there are a few important suggestions that we want to make so that this can work smoothly for you. First, if you have a recurring prescription, you should take your new insurance card to the pharmacy to make sure that they have that new information. Second, if you or a family member are taking a long-term medication, such as for high cholesterol, you will receive a letter from CVS Caremark asking you how you would like to receive future refills, either by mail order or to pick up at your local pharmacy. And as always, if you have questions about your specific prescriptions or coverage, you should contact CVS Caremark directly at the phone number located on the back of the card when you receive it. So next, I will move on to a change in our flexible spending account for fiscal year 24. So bear with me for a few moments while I say a few words about the flexible spending accounts. These are commonly referred to as FSAs. And an FSA allows you to set aside money pre-tax in each of your paychecks throughout the year, and you can use that money to pay for qualifying medical expenses or childcare expenses. It's a great way to plan for expenses throughout the course of the year and to save a little bit of money because of the tax benefit. Currently, the GIC offers our FSA plans through a company called Benefit Strategies, or Voya. But beginning on July 1st, this will change to a new company called Total Administrative Services Corporation, also known as TASC. So for your healthcare expenses, you can use a health FSA to pay for things that are not covered by your health insurance plan. So copays or deductibles. And you can also pay for dental visits or vision expenses like new glasses. For a healthcare FSA, you can put aside a minimum of $250 or a maximum of over $3,000. For the dependent care FSA, you can pay for eligible child care expenses or to care for a disabled adult dependent, and you can choose a minimum of $250 up to a maximum of $5,000. It is important to note that in exchange for the tax savings for these programs, the IRS enforces a use it or lose it rule. So if you have funds remaining in this account at the end of the year, if you don't spend them down, you will lose those dollars. There is a grace period. Again, all the details on this are in your benefit guide, but it will run for an additional 75 days after the fiscal year, so right up to September 15th. You can incur expenses. Then there'll be an additional 30-day filing deadline to October 15th to submit for expenses. So if you're interested to learn more about FSAs, check your benefit guide. So briefly here, you can see all the ways that you will be able to enroll in and manage your FSA choices, how much you want to set aside, manage payment of claims online through a mobile app. These resources will be available to you as soon as annual enrollment starts on April the 5th. So if you have an FSA plan for the coming year, there are a few things that you need to know about this transition. If you're not enrolled in FSA, you don't plan to, you can probably tune me out for the next couple of minutes. But for those of you who will enroll, there are some things that you need to be aware of. As I mentioned earlier, there's a grace period for FSA funds for the current plan year, and this grace period will be administered by the new company, TASC. So TASC and our current partner Benefit Strategies are working closely to make sure that any balances that remain in your account as of June 30th carry over. But in order for us to do that, there will be a brief blackout period that will start on June 30th. This will be a period, brief period, run probably till about July 18th, where your funds will not be available to you, but you can still use your FSA funds during the grace period. It will not impact funds for the coming fiscal 24 plan year. So if you enroll in an FSA during annual enrollment, these funds will be available to you. But if you plan to use your funds from the current year, fiscal 23, during the grace period, you can still incur expenses. Just be sure to pay your bill, maintain a record of it, and then submit a claim to TASC when the blackout period is over. So June 30th is the last day to use your benefit strategy card. If you're enrolled for fiscal 23, you will receive a new card in the mail for the start of the new year. Lastly, I just want to note briefly that if you're enrolled in the commuter or parking plans that are also administered by Benefit Strategies, you will continue to use your Benefit Strategies card for that. The GIC does not run that program. That's done through a different part of state government, and that will not be changed by the changes that we are making at the GIC. All right, so moving on from the FSA plan changes, we're almost done here. I wanted to say a word about dental and vision benefits. So dental and vision benefits will continue to be available to members who are not covered through your unions, or those of you who do not have another dental or vision plan through the Commonwealth. There are no changes to these plans this year. However, you will want to review the rates in the benefit guide. You also see them at the bottom of this slide as they are increasing slightly. So finally, I want to say a brief word about our employee assistance program. So Mass for You is the employee assistance plan offered by the GIC, and they're managed by a company called Optum. This program is available to all employees who are eligible for GIC benefits. You do not have to be enrolled in a GIC health plan. And they offer a comprehensive list of free confidential support tools. They offer virtual therapy visits, confidential therapy visits in addition to what your health plan offers. They offer consultation on legal matters and mediation. You can get assistance on financial matters like managing debt, or if you face foreclosure on your home, and a wide variety of other services. So if you've not familiarized yourself, I would encourage you to visit the GIC's website to learn more. So one last reminder that you may submit questions anytime during the presentation using the Q&A tab of Zoom. So as I've said several times, it's important to be engaged this year regarding your insurance benefits. So before we wrap up, I want to give you a few tips on how you can be prepared for annual enrollment. So here we provide a brief checklist with steps you can take. Number one, plan ahead. Make sure you get us your changes before May 3rd when annual enrollment begins. In fact, I'd encourage all of you to try to get it done on the early side of annual enrollment so that we can avoid a big rush towards the end. We want to be able to help and assist all of you. Number two, check with the insurance companies. If you're considering one of their plans, you'll want to make sure that the doctors and hospitals that you want to see are included in their network. The plans have on their websites provider directories that will include all this information, but please know that those will only be available once annual enrollment starts on April 5th. Number three, contact your doctor just to make sure that they accept the insurance plan that you're considering. And then finally, if you're turning 65 soon, visit the GIC's website. There's a wealth of information there about steps that you need to take. And finally, just some factors here that you'll want to consider when choosing a health plan. Location, where you live, will determine which plans you are eligible for. Number two, coverage type. What type of coverage really works best for you? Is broad access to providers most important, or is the premium cost that comes out of your paycheck most important? Networks, I've already touched on this. Are the doctors and hospitals you want in the plan's network? And if they are, what is the copayment tier that they're in, so that you can know how much you'll pay out of pocket. And then finally, your budget. How much are you able and willing to pay? We offer a wide variety of plans, some with broader access, but they come with higher copays and premiums and deductibles, but also some plans that exclude the most expensive hospitals and doctors. And in exchange, you can have a lower premium, lower copays, and lower deductibles. So it's important to determine which combination is the right one for you. So this slide, I won't spend a lot of time here. Again, this is really here for your reference. And again, it will be in the slide deck posted on our website. This includes phone numbers and websites for all of the insurance companies that we work with, along with a few other related organizations. Please note that, again, here, when you go to the health insurance companies' websites to look for doctors and other information, that will all be available and updated as of April the 5th. So before we move to questions and answers, I want to thank you for attending this session to learn more. Please be aware that there is more information coming your way beyond this session. As I mentioned, our benefit guides are available to you today on our website. Our health insurance companies will be reaching out to you, as well as CVS Caremark, with lots more information. And again, just visit the GIC's website. We've got a lot of information there. And if there are ways that we can be helpful to you, please feel free to contact us. So with that, that ends the presentation portion, and we're going to verbally address some of the questions that we've received in writing. And for that, I'll turn it over to the GIC's Chief of Staff, Emily Williams, to help us with that. And we have a number of other members of GIC senior staff who can help me answer some questions. Emily?
Hi, thank you, Matt. And first, I did want to address that we know our session, we were thrilled with the level of interest everyone is taking in learning more about their insurance options, and we did hit capacity at today's webinar. So if you have coworkers or fellow employees who are trying to access the webinar and unfortunately we're not able to join today, please know that the recording of today's session will be available on the GIC's YouTube channel. And the presentation deck that is being shown today is available online at mass.gov/GIC. You can also find this information in the link in the chat of today's webinar if you want to copy and paste and share that with anyone who's asking about it. And we will also be compiling a frequently asked question list from the questions that are being asked today and posting that on our website at a future date. And I, again, want to encourage members to continue asking questions utilizing the Q&A function as we go through this question and answers. I am keeping an eye on those and will be pulling from those the more frequently asked questions that can apply broadly to multiple members who are tuned in today. And the first question, we've received a lot of questions about the resources, when they will be available. Again, they'll be available on the website, and the benefit guides are already available on the website. There are different benefit guides for active employees versus retirees and municipal employees. So you will want to make sure that you're taking a look at the title on the benefit guide and making sure that it applies to you. But those are already available on mass.gov/GIC for you to view. And some of the information that Matt just went over for how to best shop and find out which doctors accept the insurance or which plans cover your networks. That information will be available during annual enrollment as the doctors are getting this information as well. So we encourage you to really check with your doctors, during the April 5th period to check what coverage is, but you can view the benefit guides now to see what plan options are available to you. So with that, I will ask first, I think, if we have Paul Murphy from our Director of Operations, to talk a little more about the process for signing up to MyGICLink and how members can troubleshoot if they're having any trouble accessing and signing up for MyGICLink.
And Leslie, maybe pull up that slide while Paul's talking about it.
Sure. Thank you, Emily. If members are having difficulty registering for MyGICLink, there are two ways we recommend that you get a hold of us. You can call our office. I'll wait till Leslie comes up to the slide. You can call our office at 617-727-2310 and speak to a member of our public information staff who will help you get through the registration process. You can also reach our office by going to our website and completing a GIC online contact form. In that form, you give us your name and phone number and the best time to reach out to you, and we will take that and give you a call to help you through the registration process. So it's some issues with whether the person has previously registered or received a PIN. We're getting a lot of questions about that, and we'll be able to look at exactly what was sent out to a member. So it's always best to call our office or reach us through the online contact form so that we can walk you through the process to register.
Great, thank you, Paul. And another general question is, if a member is not currently signed up for GIC, how should they reach out to begin that process?
If the member has no coverage with GIC, there are two ways in which you can enroll during the open enrollment period. On our website, you can go to MyGICLink online forms. It's a process called DocuSign. You can put in your information and you can select the enrollment form to submit to us during annual enrollment. So by filling out the online form, it'll be sent to GIC with your plan elections. If you don't want to use the online document form, you can go to our website and do print forms. All of the enrollment forms are on our website. You can download them, complete them, and you can mail them to our office. So there are two ways to do it, through the MyGICLink online forms, or you can download paper forms and mail them to our office. Once we enroll you in GIC benefits, you will receive an email from the GIC asking you now have access to register for the MyGICLink member portal. But we've got to get you in the system first in order for that email to be generated so that you can register.
Thank you, Paul. And I have a question now about areas of coverage. Which plan is best if you reside overseas?
If you reside internationally overseas, Unicare Total Choice, which is formerly the Unicare Basic Plan, is the plan that will cover you overseas if you permanently reside internationally.
Thank you, Paul. And can you talk about how that is different from Access America for those who reside outside of New England, but within the United States?
The Access America plan is the new plan that's available for members who are currently in Unicare Basic that reside outside of the 5 New England states. So the Harvard-Pilgrim Access America plan is new, and members that live outside of the 5 states in Massachusetts will be default enrolled into that plan if they're currently in the Unicare Basic plan, but that is only a national plan. It is not available to members outside of the US. So you will automatically be defaulted from Unicare Basic to Harvard-Pilgrim Access America if the address GIC has on file for you is outside of the 5 New England states. If you reside within the 5 New England states, there are other plans available to you, but Access America is not available to you.
Thank you. And where can members find information regarding what tiers their hospitals or doctors will fall into?
So that will be information that you can learn from each of the individual health plans on their provider directories that we've already been discussing. If anybody has something more to add to that, please do.
Thank you. And I see some follow-up questions about coverage for if you are traveling. So if you reside within New England and you are on one of those plans and you travel outside of the United States, what kind of services will you be covered for?
I think that's another good Paul Murphy question. Paul?
If you reside within the United States based on where you live in New England or outside of New England, your health plan will cover you when you travel for urgent or emergency services. So there is no need to worry about coverage. You have that coverage when you travel. So you do not need to change your plan if you were just temporarily traveling on vacation. Those plans have urgent and emergency services when traveling. All of the plans do.
Thank you. And a very general question is, when will coverage begin after annual enrollment? When will your new coverage begin?
All annual enrollment defaults, health plan changes, or enrollments all take effect July 1st, 2023.
And just to clarify, Paul, this applies not only to the health plans, but to the dental vision benefits and FSA benefits as well, correct?
Yes, with the new FSA vendor, they do have to enroll during open enrollment for the HSA and DCAP benefits through TASC. Dental and vision, if a member wants to change their dental election or enroll in the dental plan, open enrollment July 1st. Retirees signing up for a retiree dental plan with GIC, July 1st, and all health plan changes or enrollments are effective July 1st.
Thank you. And now turning to pharmacy, we have received a number of questions asking if the new PBM vendor as CVS Caremark will require you to go to only CVS pharmacies for your prescriptions.
Yeah, that's a great question. The answer is no. You still have broad access to a range of retail pharmacies as you do today under Express Scripts. So while they are part of the same overall corporation, the PBM that we are working with, PBM Caremark, and a CVS retail pharmacy are really separate entities. You will continue to have broad access to a range of retail pharmacies. I don't know if there's anything more, Janine Dewar on our team who manages our prescription drug benefit work, if you wanted to add something to that.
Just that maintenance medications should be filled through CVS retail pharmacies or mail order.
Thanks, Janine. Can you expand on what you mean by maintenance medications?
Yes, so that would be a medication that you take long-term, for instance, high blood pressure or blood pressure medications.
Thank you. And we've had a number of members ask about if there will be a new specialty pharmacy with the change of PBM.
Emily, sorry, Janine, you want to take that one as well?
Yes, Accredo is the current specialty pharmacy that's associated with Express Scripts. CVS has its own specialty pharmacy, so it will switch over to CVS's specialty pharmacy.
Thank you.
Thank you. And now turning to FSA, we have a number of questions asking if you can speak a little more about what the FSA, what qualifies as an expense under the FSA plan, what you might use
Yeah, so I'll
that
have
accountant funds for.
Thank you. I'll have Cameron McBean speak to that. I will just say that the list of things is pretty broad. I mentioned co-payments and deductibles, dental care, vision care, eyeglasses, contacts, but there's a long list of eligible expenses. Those are managed by the Internal Revenue Service. But you, if you simply did a Google search, or you want to talk to the folks at Task, if you enroll in the plan, they can help you understand what expenses are eligible. But you can even use your FSA card for a range of things that you can get at a pharmacy. So for instance, Band-Aids are on the list, and there's a range, but there's a definitive list managed by the IRS. Cameron, you want to add to that?
Sure. Yeah. During the pandemic, the IRS did open a lot of over-the-counter items, like Matt mentioned, that are now available. Complete lists are available on both FSA vendors' website. The new FSA vendors site should be up and running by April 1st, but you can look and find the same information currently on the Benefit Strategies or Voya website. Generally speaking, anything that you get charged for at a doctor's office or dental or other dentist or other sort of medical provider would be an eligible expense for the healthcare FSA. The dependent care FSA is for childcare expenses while you are working. We see this a lot, and while I've got everyone's attention, I want to make clear, if you are looking to pay for the medical expenses of your dependent family members, your children, do not use the dependent care, the DCAP account for that. That is for child care while you are at work. It can also be used in rare instances for elder care. If you are responsible for an immediate family member over the age of 26 who is disabled in some way, shape, or form, you can use the DCAP for those expenses. That is it. Once your child turns age 13, you can no longer use the DCAP funds. We see this a lot every year. Somebody accidentally enrolls in the dependent care account, intending to cover their family's medical expenses. That is what the HC, the healthcare savings account, is for.
Yeah, and it's a good question. We would love to see more use of the healthcare FSA in particular. Utilization of it is relatively low, but it's a great way for you to set aside money and plan for anything that you need to spend money on. The use it or lose it provision is something that you'll have to manage. I know myself, I've used the FSA. If I come to the end of the year and I have a balance, I go to that list of eligible things I can buy, and I'll stock up on Band-Aids and other things to have around the house. So it takes a little getting used to make sure that you kind of plan ahead and use all your funds.
Wonderful, thank you. And if we can go back to the rates slide, I see a lot of members asking to view that slide again. Thank you. And I have a question that I think I would send to Paul. If you can give some clarification, Paul, about who qualifies for what different benefits the GIC offers.
Sure, I can talk about that. I just want to note here, I see a few questions on the rate slide. These are the state employee contributions monthly premium, as Matt indicated earlier. And you have to do the math based on how frequently you get paid during the month. Some state entities pay weekly, some pay bi-monthly, and some pay monthly. So the rates are posted a monthly, but you have to calculate based on your payroll cycle of what gets deducted from each paycheck. Also, these are just state employee contributions. Municipal employees, we see a few questions, have to contact your municipal benefit office for your exact premium rates for FY24. These are only state employees. As far as benefits go, we can start at the top. The easiest one is if you are a participating municipality with GIC, we only offer health insurance for municipalities. That is the only benefit we offer for our municipalities. On the state side, we offer life, health, dental, and long-term disability. For the dental plan, there's always seems to be a lot of confusion about what plan and who is eligible. The plan that GIC offers is a GIC dental and vision plan that is available to members that are not covered by collective bargaining. So if you are not covered by collective bargaining, you can enroll in the GIC dental and vision plan. If you are covered through a union or covered by collective bargaining, your dental and vision plan is through your union. It is not through the GIC. We do not administer those plans. You have to contact your union directly with questions about benefits or enrollment. If you are a member of higher education, again, higher education, community colleges, universities in Massachusetts have their own dental plan. You have to go to your benefits office at your college or university. GIC does not cover that dental and vision plan. So there are many different plans available in the Commonwealth, but ours is very limited to only managers, people that are not covered by collective bargaining, or constitutional officers. Other than that, you have to go to your union, your benefit office, or your municipality to find out about those dental benefits or vision benefits and to make changes.
So when it comes to the health plans here that we see on this slide, again, it depends on geography, right? So if starting at the top, Access America, as we've said, the Harvard Pilgrim Access America is for those who live outside of New England. And that is the way we're defining that is 6 months plus 1 day living outside of New England states. The broad network plans that you see, all available to residents of New England. The limited network plans, the Harvard Pilgrim Quality HMO and Unicare Community Choice. Someone can correct me if I'm wrong, but Harvard Pilgrim Quality HMO is available to Massachusetts residents. But it depends on the county. You will have to check the benefit guide to determine which county, because Harvard Pilgrim Quality HMO is not available in every part of Massachusetts. Community Choice, as I understand it, is available to anyone in Massachusetts. Health New England, only areas of Western Massachusetts, so it's important in your benefit guide to see which communities are covered. Did I get all that right?
Yes.
That's correct, Matt. Quality HMO is not available on the Caper Islands.
And I think it would be helpful to qualify or to clarify which states are considered New England for our benefit purposes.
Yep, Maine, New Hampshire, Vermont, Massachusetts, Rhode Island, Connecticut.
Wonderful, thank you. And we are receiving a number of questions about dependents coverage. If you have a dependent who perhaps goes to school in another state or resides outside of New England, but you as the enrollee reside within New England, what are your plan options?
I can take that, Emily.
Thanks, Paul.
We can start at the top of this chart, looking at the chart. Harvard Pilgrim Access America, as we indicated in this seminar, is only available to members that reside outside of the 5 New England states. So if you reside outside of those 5 New England states, you can enroll in the Harvard Pilgrim Access America. If you're in the Unicare Basic Plan, that is changing to total choice, you will be automatically defaulted into the Harvard Pilgrim Access America based on your address on file with GIC. For that plan, they cover dependents nationwide. So there is no worry about dependent coverage. If you reside within New England, there are several plans available to you. As Matt indicated, you've got the Unicare Total Choice, the Harvard Pilgrim Explorer, the Unicare Plus plan. Those three plans cover all of New England. And they do have a national network that covers dependents outside of the New England area. So that's Total Choice, Unicare Explorer, and Unicare Plus. They cover dependents outside of New England. For Health New England, Mass General Brigham, and the Harvard Pilgrim Quality HMO, they may have some coverage for dependents outside of New England, but we always recommend to contact the plan directly for that out-of-network benefits for dependents that live in another state. So it's always best to check with the health plan for the coverage for full-time students or dependents that live out of state. But your larger plans, Total Choice, Harvard Pilgrim Explorer, and Unicare Plus, do have national networks that will cover dependents outside. But some of your plans that are in Massachusetts, it's always best to check with the plan directly about their coverage for dependents or students in another state.
Thank you, Paul. And I think a good follow-up to that is there are a lot of questions. If you could speak high level about what a qualifying event is, and then more specifically, I see questions asking if you move, if you move your residence either outside of state or if you live outside of state and you move back into New England, if that is a qualifying event to enroll in a new plan.
Sure, I'll take the simple one first. If you move outside of New England, whatever plan you are enrolled in, you will have to enroll if you want to keep your GIC benefits in Harvard Pilgrim Access America. That is going to be the only plan outside of New England available to you. If you reside outside of New England and you move back into the New England area, then you will change to any plan that's available within New England. The 6 plans I outlined: Health New England, Mass General Brigham, Community Choice Plus, Total Choice, and Explorer. So you will have the opportunity to change plans when you move back into New England, because you will no longer be eligible for Harvard Pilgrim Access America. So it really depends on where you switch your residency. It depends on what plans are available. If you move out, it's only going to be Harvard Pilgrim Access America. If you move back, then you have a choice of all the plans that are outlined in the New England area. GIC will require proof of your new residency. So we can verify your address, update the address in our system, and make the health plan change. Qualifying events have a 60-day window. So moving, birth, marriage, divorce, all of those life events, you can make changes to your GIC coverage, but you have to give us the documentation such as a birth certificate, marriage certificate, divorce documents to make changes, and it must be received within the 60 days of the event. So during annual enrollment, you can make all changes to your benefits, no questions asked. But outside of annual enrollment, it is only with the qualifying event within 60 days of that event with the documentation. If it's not received within 60 days of the event, then you have to wait till the next annual enrollment period.
Thank you, Paul. And Matt, can you go over the difference between the plan types again? That's HMO, POS, indemnity.
Yeah, so this can get complicated. I'll start with an HMO, and I may ask my colleagues to clarify or correct something I get wrong. So an HMO is typically described as a closed network plan. So you can only use that plan to go to the specific hospitals and doctors that are included in that plan's network. There's no out of network benefit, unless there's a really extraordinary circumstance. An HMO requires you to designate a primary care physician to serve as kind of a gatekeeper and a manager to get referrals, but they serve as kind of your home base for your health insurance and your healthcare coverage generally. A POS plan, short for point of service plan, offers an in-network benefit. It's very similar to the HMO, but if you want to see a provider outside of the network, you do have that ability. It does come with a somewhat higher premium, and it does come with higher co-pays and a deductible when you see a provider that's outside of the network. And however, there's one little wrinkle. If you get a referral from your primary care doctor in a point of service plan, you can still get the in-network cost sharing, even if you go to an out-of-network provider. So I think the questioner also asked us about a PPO plans. We do not offer PPO plans except for the Access America plan. So if you're in New England, you only have the point of service plans. And the only difference there between a PPO and a POS is that you just need that referral from the provider to get the in-network cost sharing. An indemnity plan is the broadest plan, so it has the access to a wide range of the widest range of hospitals and doctors.
Thank you, Matt. Okay, our staff is answering questions quickly in the Q&A, so I am continue to look for those questions which apply broadly. Can we clarify one more time about the new FSA administrator task and how that differs from the transportation benefit and their administrator Voya?
Cameron, you want to take that?
I'm sorry, I was busy typing. What was the question again, please, Emily?
Hi, Cameron. Just the difference between the transportation benefit and the
Sure.
FSA transition.
Sure. Yeah, the transportation and parking benefits will remain with Benefit Strategies, or Voya, as they're now known. Those benefits are administered directly by the Comptroller's Office, so the GIC does not have any input or influence on those benefits. So if you currently participate in those and use your Benefit Strategies or Voya debit card for those transactions, your card will remain active after June 30th for those benefits only. So if you're a current FSA participant and you re-enroll with the new vendor Task for the new plan year, Task will eventually receive your any remaining funds from fiscal 23. We will have that blackout period while Voya reconciles and closes out everyone's accounts. Then they have to transfer that information over to Task. Task will then have that up and running. You can use your new Task debit card from July 1st immediately, as long as you are a participant next year, and you will have the entire year's election available to you. Once the blackout period is over, anytime you use your card between July 1st and September 15th, that's our grace period. The debit card will pull from your fiscal 23 balances wherever available first, and they will also go back and retroactively adjudicate and correct any claims that could apply during the blackout period that you may have used your debit card for, they will apply those against any available fiscal 23 balance without any action on your part.
Thanks, Cameron. And I see a little bit of confusion about the plan year for FSA. I think there's a difference between for the some municipal employees versus state
Yes.
employees. Can you give a clarification? Thank you.
Yes, I've been answering a lot of those myself. Yes, if you are a municipal employee, you are not eligible to participate in the GIC's FSA plans. You likely have them available through the municipality or entity that you work for. And many of those FSA plans operate on a calendar year, not the GIC's fiscal plan year.
Wonderful. Thank you, Cameron.
You're welcome.
And I have a question, I think probably for Paul. I see members asking where they can find information if they or their spouse is turning 65 outside of annual enrollment at any time during the year.
Sure. On our website, if you search for turning 65, there is a video that will help members walk through what needs to be done at age 65. Since this is an active employee session, I don't want to get into too much on what happens when you retire, but I can say that if you are going to continue working for the Commonwealth or a municipality after age 65, you do not have to enroll in Medicare Part A and Part B. The plan you are currently enrolled in is the plan that will cover you while you continue working after age 65. It's only when you retire from the Commonwealth or a municipality you can elect a Medicare plan with the GIC. But until that time, the plan that you are currently enrolled in, whether you're under 65 or over 65, and you continue working for the Commonwealth, is the plan that will cover you. But the video will also help you, and we do have a Q&A session about turning 65 on the GIC website.
Thank you, Paul. And Matt, we've had a few questions asking if the GIC offers an employee plus one offering for members.
We do not. We are asked this periodically, and we do evaluate and study that to see if it can provide a more affordable option on our portfolio without broadly disrupting our premiums. At this time, based on the analysis that we've done, we are not deciding to add an employee plus one plan.
Wonderful. Thank you, Matt. And I'm just taking a look at the questions. Thank you for waiting as we near the end of the session. Can you clarify if the health plans, if this includes mental behavioral health benefits as well? Or if those
It
are
does.
separate?
Yeah, so each of our plans has very broad coverage for behavioral health services. Each of them manage it a little bit differently. Some of them have what's called a carve out or a behavioral health management company that does it as a partner of theirs. Others manage it in the same way that they manage any other medical procedure. So there is no separate company that they work with. So the coverage is broad and rich across all of our plans, but the way that they each manage it is somewhat different.
Thank you, Matt. And again, I see a lot of members asking about when the doctors will or the health plans will have the information about networks and coverage. And again, I think it's best to call your doctors during annual enrollment. So starting in April, if you want to check on coverage, but the benefit guides are available to look through all of this information now. And I encourage members to continue asking their questions in the Q&A function. Back to the pharmacy transition. Can you speak a little bit about what members may need to do, what action they may need to take, if any, to transfer prescriptions that they already have?
That's a good one for Janine Dewar to take.
I'm sorry, can you repeat the question?
Yes, I think for members with pre-existing prescriptions, what type of action they will need to take, or what they should look out for during the transition with the PBM.
CVS will be reaching out to members. If you do have any refills left, you'll receive a letter. If there is any kind of potential for disruption, you will be contacted. And everything will transfer over from ESI to CVS, Express Scripts, excuse me, to CVS, and prior authorizations should be on record as well with CVS Caremark once the transition is established.
Thank you, Janine. And I do see questions about if the Q&A will be available after this session. And again, we will be compiling a frequently asked questions list to protect members' privacy and make sure that no personal information is shared. We will be going through and pulling out the most frequently asked questions. And again, you can find all of these resources online at mass.gov/GIC. And thank you for your patience. I'm just letting our staff continue to answer the questions. They're answering them very quickly in the Q&A. I see a number of questions asking about from members who have dependents who are turning 26. Perhaps Paul can address what that means and what action members may need to take.
There's no action needed, Emily. If a member has a dependent turning age 26, GIC coverage ends at the end of the month in which the dependent turns 26. So they get the full coverage through the end of their birthday month. At that time, GIC will also send out information to continue coverage through a COBRA option if they choose, but coverage does end the end of the month in which the dependent turns 26. And Emily, I'm also seeing a couple of questions about clarification on the turning 65. I just want to, if you are under age 65 and you retire from the Commonwealth, the plan that you are enrolled in at the time of retirement will continue. You only can have the non-Medicare plans with GIC. It's only when you, the member, or your spouse are turning age 65 and retired where you have to elect a Medicare plan. So whether you continue working after age 65 or you retire before age 65, you stay in the plan that you have with GIC. It's only when you turn 65 and you are retired that the Medicare choices come into play.
Thank you, Paul. And I see a number of questions asking if we can clarify why Unicare is listed as a PPO type and what that means as opposed to POS.
Not sure who should take that one. Would that be Andrew or perhaps Cameron? Go ahead, Cameron.
Sure, I can. Yeah, because Unicare itself is an indemnity insurance carrier, they basically custom crafted the Plus and Community Choice plans, even though they are, in their basic framework, the chassis, so to speak, of the insurance plan. It's still an indemnity plan, but we wanted to create products that functioned, community choice functions similarly to an HMO, in that it's got a limited network. And similarly, the Plus plan is intended to function much more like a traditional PPO, and that you have better benefits when you see in-network providers. And for Plus purposes, any provider in the state of Massachusetts is considered in-network. It's when you go outside of Massachusetts, you're then participating in the Anthem network and using their providers in order to maximize your benefits.
Great. Thank you, Cameron.
Welcome.
And as we near the end, I do see a lot of questions about resources still, and I want to clarify that benefit guides will not be mailed this year. You should go to mass.gov/GIC where you can view the benefit guides online. And again, all other resources are, I encourage you to visit our website at mass.gov/GIC. And you can take a look now at the links provided in the chat to provide a lot of additional information and background to some of the questions asked today. And as we are now near the end of our session, I will hand it back to you, Matt.
Great, thanks, Emily, and thank you to to the GIC team for assisting with the questions and answers throughout the session. I want to thank all of you for attending and learning more about the options and what's changing for this coming year. As we've said many times, this is a great year to engage with us, to spend time with your benefit guide, really take control of your own choices here. We will make sure that you don't go without coverage if you don't act, but it may be in a plan that does not meet your needs or will lead you to have a higher premium than you're able to pay. So this really is a great year to engage with us and do a little bit of homework. We understand this is complicated. We try not to make too many changes, but we really have to make some changes. And this is the year where we're making more. So thank you for your time. Thank you for your patience. And thanks for joining us today. And please let us know how we can be helpful to you. Our staff are available just a phone call away or with the online contact form. Please let us know how we can be helpful to you. Thank you and have a great rest of your day.